Our next story is about something that could affect over half of the adults worldwide. Over half of the adults across the world. According to a new study, rates of obesity and overweight are soaring to the extent that more than half of adults and almost a third of children and young people are set to be affected by 2050. Can you imagine that? That's the gravity of the crisis that we are dealing with. Just to lay this down in terms of numbers, according to research published in the Lancet, this basically represents more than 3.8 billion adults and 746 million children and adolescents. The team used data from 204 countries and territories to come up with their estimates and basically project what could happen in the future without action. What could happen in the future without action. And according to them, the rates of overweight and obesity have already more than doubled over the past 3 decades, with more than 2.1 billion adults and 493 million young people between the ages of 5 to 24 years affected as of 2021. Those are staggering numbers. In fact, with the Lancet study predicting that nearly a third of India's projected population will be overweight or obese by 2050. As you may be aware, obesity is associated with an increased risk of serious health problems like diabetes, some cancers, heart disease as well. It's been called a global epidemic of overweight and obesity, also a monumental social failure. But how exactly can one course correct? According to researchers, governments should use the estimates to focus on how to help populations most at risk, particularly around improving access to healthy diets and looking at the severity of the crisis. Experts have gone to the extent of suggesting that obesity must be officially recognized as a major non-communicable disease. Now, going back to the study we just told you about, it does have limitations reportedly, including data gaps and the use of body mass index as a marker. Not just that, it did not take into account the potential impact of obesity drugs, which have seen a huge demand in richer countries where they are available. And we have been telling you about this. So while the picture looks different in different parts of the world, researchers have said an accelerated rise in obesity among young people and the rise in low and middle income countries where health systems cannot cope with the coming disease burden were particularly worrying. In fact, what's also concerning here is that a separate study has raised the issue. It's called the World Obesity Atlas from the World Obesity Federation. According to the president of the federation, the most affected regions are developing countries. The fact of the matter is, this is one of the biggest public health challenges at this point across the world. The question still remains, are we really doing enough to tackle this? To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.